Hi, Dr. K.Erdogan, ASMED Clinic, Istanbul. Today I want to talk another taboo: hair transplantation, hepatitis B, hepatitis C, HIV patients. Treatment decision. Hair transplantation has been frequently applied for aesthetical surgical procedure, though hair transplantation has a low complication rate compared to other aesthetical surgical procedures. The hair transplantation has some complications, but mostly not severe and manageable. These are some complications of hair transplantation you can see here. Among 35 billion health workers worldwide, about 3 million receive percutaneous exposure to blood-borne pathogens each year. 2 million only hepatitis B, 900,000 hepatitis C, 170,000 HIV. And when we check the infections, 70,000 hepatitis B infections, which is 3.5%, 15,000 hepatitis C infections, which is 0.1%, and only 500 HIV patients, which is 0.3%. And important, 90 of these infections occur in developing countries. Safety is the minimization of risks while maximizing the quality of life. Blood-borne viruses such as hepatitis B, hepatitis C, and HIV are transmissible in healthcare settings and can produce chronic infection and often carried by persons unaware of their infection. So this shows the importance of serologic tests also. Preventing exposures to blood and body fluid is the most important strategy. Both individual healthcare providers and the institutions that employ them should work to ensure adherence to the principles of standard precautions, including ensuring access and consistent of appropriate work practices, work practice controls, and personal protective equipment. Protective equipments, gloves, masks, eye protection, face shields, aprons, and gowns. I want to focus on eye protection because I know we are all, while working, we are using loupes, so eye protection is the hardest part and it's most important. I think the glasses and face shield are very important. Immunization before and after the contact, this is important for, especially for hepatitis B. And after exposure has occurred, appropriate post-exposure management is an important element of workplace safety. I will talk about this later. Hepatitis B can be safely protected by an effective vaccine. So it's easy to protect ourselves and our teams from hepatitis B. But hepatitis C cannot be prevented by any vaccine. But chronic hepatitis C can now be cured with effective antiviral treatments just in 2 weeks. Human immune deficiency virus. Infection with human immune deficiency virus remains a significant public health concern in every country worldwide. However, with effective treatment, patient survival is increased. HIV is the virus responsible for acquired immunodeficiency syndrome, a chronic disease that places individuals at high risk of occurring opportunistic infections. HIV infection can be transmitted through contact with infected human blood or semen, vaginal and rectal secretions, breast milk, or other body fluid that is contaminated with visible blood. Every HIV positive patient needs a safe, welcoming, non-judgmental environment and providing equitable care, which is very hard with uneducated health service provider. Medical histories are important for all patients, and this is especially important for those who are infected by HIV, since they are more likely to be medically complicated. Since HIV may be asymptomatic and may go unrecognized, standard precautions for infection control should be observed for all patients. This is important. In prospective studies of healthcare personnel, the average risk for HIV transmission after a percutaneous exposure to HIV-infected blood has estimated to be approximately 0.3%, which is very low. After a mucous membrane exposure, approximately 0.09%, very, very low. Surgical interventions of HIV positive patients is considered to be safe and humane in era of modern antivirals. HIV patients receiving highly active antiviral treatment don't pose a danger to healthcare personnel who treat them. Patients are receiving antiviral treatments are considered non-infectious when CD4 level is above 200 or viral load is below 50. This is very important because many health providers doesn't know that. That's the reason of the fear. If the patient is under treatment and if viral load is very low and its CD4 level is high, he's like a normal person. He can have marriage, he can have babies. We are missing this point mostly. However, in case of parenteral exposure of HIV patients' blood, that means HIV patient blood is parental way in your blood, infection transmission is not seen with post-exposure prophylaxis regimen started in the first 4 hours. That means after exposure, we have some treatment regimen, and if you start in 4 hours, it's not dangerous and you can protect yourself. This is another point people doesn't have an idea about mostly. These are some post-exposure prophylaxis regimen alternatives. For example, in my clinic, I always keep some of them in the refrigerator just in case. Hair transplantation and HIV positive. Indications for hair transplantation other than surgical procedures are the same for HIV positive patients for any other patients. Preoperative patient evaluation and scaling may be performed to help reduce the risk of postoperative complications. All procedures must be performed in a manner of minimizing bleeder, and experienced staff is also very important. A study investigated surgical intervention risk in HIV positive patients over 16-year period. Retrospective examination of medical records of 2,100 cases and 772 surgical procedures shows low complication rate. Incidence of complications was highest in patients with CD4 account was below 200. So if CD4 account is below 200, complication risk is high. And it's very low when CD4 is over 60. HIV stigma might have an adverse effect on HIV patient rights to have treatments. So this is important. I know hair transplantation is an elective surgery, but in this social media, is it really elective? I know many of you made your patients happy, they have more self-confidence. Hepatitis B, if you are vaccinated, if your team is vaccinated, and if you're controlling your antibody regularly, not a big deal. Hepatitis C, okay, we don't have any vaccine with hepatitis C, but chronic hepatitis C patient can be cured in just with very strong antiviral treatment in just 2 weeks' time. So, HIV. If the patient is not accepting any medication, I can understand. If viral load is very high, I can understand. But if the patient is under medication, his viral load is very undetectable, is lower than 50. CD4 level is higher than 200. So he's a normal person. And of course, you have to keep your post-exposure prophylaxis regimen in your clinic all the time. But I believe everybody deserves this treatment. Thank you very much.